Hello, everybody. I'm Don Walker. I'm Communications Director for Brevard County Government. We're here today to do a press briefing on the COVID-19 coronavirus status in Brevard County. We've got a variety of officials here that will be giving some brief presentations. I'll start the show, and then I'm going to turn it over to Matt Wallace, our Public Safety Director, and then we'll hear from Chief Mark Schomeyer, our Fire Rescue Chief, and then we'll hear from Commission Chair Brian Lober, who's also the chair of our policy group, and then we have Bruce Pierce with the Florida Department of Health. So from a county standpoint, we've closed all of our government facilities to the public, but I just want to let people know that all of our normal operations continue. We do have some staffers that we have let go home, those that are 65 and older or medically vulnerable, and also folks that need to be home with other family members or are able to do virtual work, whether it's teleconferencing or just doing work from their computers at home. But all of our day-to-day operations continue as normal, except for the fact that the public are not being allowed in our buildings, but they can get access to us on our website at brevardfl.gov. From a county standpoint, as of today, we've got 9 cases, presumptive positives in Brevard County. There's roughly 150 of those. That's 9 of 150 roughly cases in Central Florida. Of course, testing, as you know, is limited due to availability of test kits. That's not a Brevard County problem. That's a nationwide problem. I just want the public to know that our emergency management department is working closely with the Department of Health, and we continue to encourage people to social distance and to treat everyone else like they might be contagious. So keep that 6-foot distance that's recommended by the Centers for Disease Control. We're doing all we can to communicate with our citizens the status of what's happening with the spread of COVID-19, what the county's doing to prepare and respond, and we're doing that through press releases, we're doing it through social media, we're doing it through live interviews, we're doing it on Skype, we're doing it on FaceTime, we're holding press conference. We have this one today. We started off about 3 weeks ago with a big press conference with a lot of officials and 3 waves of media interviews. So we are putting out an extra effort to get word out. We understand that not everyone follows us on social media, but we are using various avenues to get the message out. And if you know of any avenues that we're not using, if you would please let us know, we will move in that direction as well. I want the public to know that you can follow us in a variety of ways to get information that we're putting out daily and hourly on COVID-19. You can text Brevard EOC to 888-777 for emergency alerts. You'll get those on your phone. You can follow us on Twitter, and that's at Brevard EOC or at Brevard County _Florida, or FL, sorry. And on Facebook at Brevard County Emergency Management or Brevard County Government. I would like to now introduce Matt Wallace, our Public Safety Director.
Thank you, Don. And first, I would also like to thank all of you for being here today. One of our biggest responsibilities we have in government and as senior leaders is to make sure we get communication and word out to those citizens that we serve. So I appreciate all of y'all being here today. One of the biggest comments that I've been getting from the citizenry is, what are we doing as a government? Where are we going to be next week, next month, in the next quarter? So I'd like to talk for just a few seconds about the command and control efforts that we have in place here in Brevard County. And it starts with, we have 3 groups, that have stood up since this occurred, who are meeting almost daily to make sure that we stay ahead of this and we get ahead of it and we don't look back. Those 3 groups, starting at the top, at the strategic level, is our Brevard County Policy Group. It's led by the chairman of the County Commission, Commissioner Lober. We meet with senior leaders across the county, functional experts who at the most strategic top level talk about where we're going policy-wise for the county. So anything that comes out that affects the entire county, that group looks at, evaluates, discusses, and comes to a consensus of where we should go in the best interests of the citizenry of Brevard County. Below that level, at the second level, at the operational level, we have what we are calling the task force, the Brevard County Task Force. That group is led by the county manager and involves key directors across county government. They are looking at processes in the county government on a day-to-day basis of how we get those out to serve the public. So what government functions are there, what we can use to get out to the county, and how we innovatively get those services to the county on a daily basis. That group meets daily to discuss those type of issues to make sure that we are still serving the public. Then at the very tactical level, the action level, we have the EOC, which is now at a level 2 activation. The Emergency Operations Center is where the rubber meets the road, the tippy end of the spear, where tactical actions that serve the community happen. The EOC in that level 2 activation is comprised of emergency support functions, or ESFs, that are functional experts across the county, across county government, across the medical professions, across everybody. They get together almost daily as well to talk about what is happening today, and they start talking about what is going to happen in the future. We have a comprehensive emergency management plan, or a CEMP, where the EOC and the emergency management staff have planned for pretty much everything that's going to happen in the county. We have a pandemic plan. We have that plan set out from start to finish, from the start of the contingency till the time we can declare victory and wrap it up. That plan is constantly talked about at the EOC level about where we're going to be tomorrow, next week, next month, in terms of how we're supporting local hospitals, how we're supporting the elderly in nursing homes, how we're supporting the schools. With all our community partners coming together at one time, they are able to address those needs as they happen real time. But also, more importantly, they raise issues and find things that if they can't figure out how to get things done, they can raise that issue to the task force level. And if the task force level can't figure out what they're doing or how to solve those issues, we can raise those then to the policy group. So those 3 levels of groups are always acting, always meeting, always discussing what's going to happen today, tomorrow, and next month as we roll out and we get to a better place. Right now, it's all about prevention. It is how we will win this is about prevention. So I would ask all the citizens of Brevard County to continue to look at the CDC website, to continue to look at the Florida Department of Health, and continue to do those practices of social distancing, not gathering in big groups. If we can stop it now, we will be a better future. And regardless of what this happens, we are going to have a better nation. We're going to have a better community and a better citizenry. These adverse times create heroes, and we have them all through the county right now. First responders are doing great things. Your emergency management is doing great things. Your Brevard County government is doing great things. We will get to that better place together, no doubt, as we continue to work together. So I'd like to transition this over then to my favorite fire chief in all of Brevard County, Chief Mark Schomeyer, and he'll talk a few words about what we're doing from an EMS side as well as fire prevention. So, Chief.
So as far as Brevard County Fire Rescue is concerned, I hate to use a term, but it is business as usual, but with a few extra safeguards in place to protect our people and our citizens. We will continue to respond to 911 calls as always, and to provide the best service to our citizens that we can. However, we may look a little bit different when we arrive. We are wearing extra protective equipment for those patients who are presenting with flu-like symptoms, and we want everybody to be aware that although it looks scary, it's for our protection and their protection. I also want to remind people that the 911 system is used for life-threatening emergencies or serious emergencies only. As we enter into the coming weeks and the coming months of this COVID crisis, our system will get strained, and so any extra 911 calls are going to put a little bit extra strain on the system. So only use 911 for emergencies and life-threatening events like that. I also want to remind any nursing homes, ALFs, or other institutions like that, even those at home, if you do have flu-like symptoms, to wheel those patients to the lobby, to the outside. If you're able to ambulate and get outside of your house, meet our crews outside if you can. That way it limits our exposure inside the house and protects our crews a little better. That's about all I have.
Wildfires.
Wildfires. So as we approach wildfire season, it's been getting dry. Our KDBI is about 481 right now. Our burn ban goes into effect at 500 KDBI, and what that means is by this weekend probably we will hit the threshold for a burn ban. And the reason why it's so important is because wildfires are a very strenuous in terms of our crews and manpower and personnel. And so any additional wildfires created by carelessness in terms of open burning and that kind of stuff, fireworks, will create additional strain on our system, and we want our citizens to be better protected. Commissioner Lober?
Thank you, Chief. And thank you all for coming today. Bear with me, I'm going to be relying on notes for a portion of this. There's some items that I want to be sure that I thoroughly cover. So the policy group, which was referenced earlier in this press conference, consists of me, by virtue of my service as chair of the County Commission, Florida Department of Health Administrator Marie Stahl, Sheriff Wayne Ivey, Brevard Public School Superintendent Mark Mullins, Scott Morgan with West Melbourne, and Jim McKnight with Cocoa Beach, both city managers, on behalf of the League of Cities. We also have our fire chief, we have our county manager Frank Abate, we have our county attorney Eden Bentley, and we have our public safety director Matt Wallace, who you've heard from. I've also invited various elected officials to participate in the calls, including a port commissioner, a representative from Patrick Air Force Base, all of our elected state representatives and state senators, as well as Congressman Posey. And each of them has been very helpful in their input. I want to talk a little bit about the actions of the policy group and what we've done that may be particularly noteworthy. So on Saturday, March 14th, as many of you know, the policy group declared a local state of emergency here in Brevard, including all of the municipalities contained within it. Benefits of having done that and the reasoning for having done that largely is financial, to ensure that we have a better ability to seek reimbursement from FEMA, from federal sources. It also streamlines our intergovernmental crisis management system. It provides timely access to financial resources by cutting red tape. And what I mean by that is if we need to obtain personal protective equipment for our first responders, firefighters, EMTs, paramedics, we have to obtain that. If it's 10 cents more to buy it from someone that has it available, that's local, it's not worth our going through the bidding process during a time of emergency. There are other reasons that we can do this that deal with timely response. I'm not going to waste your time by going through each and every one of them. They've been discussed previously. One of the other things that we've done as a policy group, about a week after, on Thursday, March 19th, we closed all of the beachside parks as well as the beachside parking lots throughout Brevard County, even though the beaches themselves technically remained open. We did this because we had calls coming in from city managers and elected officials at the beachside municipalities saying prior to spring break weekend, we had folks that were in essentially Disney World or Mardi Gras conditions, shoulder to shoulder, where transmission of any kind of a biological pathogen, whether it's a virus as we're dealing with now or anything else, was basically assured. We had to do something in order to cut the number of individuals that were going on the beach. The goal was to do the least restrictive measure that would accomplish that goal. None of us in Brevard County, none of us on the policy group or the county commission want to infringe on anyone's liberties or anyone's ability to go out and do what they wish to do. But in times of emergency, we do sometimes have to do sometimes do have to implement slight restrictions to effectuate the goal of ensuring public health. So with respect to whether or not that was successful, I can tell you that the numbers I've received from a beachside community, one of the larger ones in the county that also happens to be in my district, Cocoa Beach, we saw a 75% reduction from year over year what we had last year during spring break. Given the fact that a number of the beaches throughout the state are closed, it's even more effective than that relatively impressive number already conveys. Today, the policy group discussed the potential of shutting down beaches altogether during a portion of daylight, so potentially from 9 or 10 in the morning until 4 p.m. We didn't rule it out, but we also didn't approve it at this point. I'm continuing on a daily or sometimes more frequent basis to touch base with folks over in the beachside communities, elected officials, and high-level staff to ensure that we're responding in a fluid and dynamic and efficient manner to their needs. I plan on touching base with them again tomorrow morning or early afternoon. If necessary, if the conditions appear to be worsening over there in terms of the number of individuals that are out on the beach, such that there's a concern that social distancing may not be able to be maintained, at that point I'll go ahead and I'll call a special meeting of the policy group, and we will look at putting in place those restrictions. One thing to be mindful of, though, with respect to any closure of beaches or parks, it's not productive if we don't all act in concert. So the federal facilities, the state facilities, the county and municipal facilities, if we just close some and they don't all close, all we do is concentrate individuals in a smaller area, which is counterproductive. So if we do it, it's in all likelihood going to apply throughout the 70 some odd miles of coastline that we have here in Brevard. I do want to take one last brief moment to discuss press conferences and what our strategy has been with respect to press conferences here in the county. Well, Don spoke a bit about our messaging strategy. I want to talk about our press conference strategy more specifically. Our strategy is one, generally speaking, of less is more. And let me elaborate just a little bit on that. None of us feel the need to parade in front of cameras for our own benefit. We have intentionally not held press conferences because there's been a lot of repetitive information that has gone out both at the federal level, the state level, and at other localities. The recommendations, and I don't need to read from notes for this, with respect to washing your hands for 20 seconds or longer with warm water and soap, or in the alternative, if that's not available, using hand sanitizer with at least 60% alcohol, maintaining your social distance of at least 6 feet, staying away from crowds larger than 10. Everyone knows that. For me to get in front of a camera here and say that, I don't know that that's terribly beneficial. My concern and the policy group's concern is that we don't want folks tuning us out because what we're saying to them they've already heard. We've been inclined to keep the press conferences limited to a minimum so that you listen and so that the biggest possible audience listens when we have something of note that's worthy of conveying to you. So when we have milestone marks that we reach, God forbid whether it's the first death as a result of coronavirus in Brevard, or whether it's a milestone number in terms of the cases that we hit, we will have press conferences. But there's nothing that we gain by having frequent or recurring press conferences on a daily or twice weekly or perhaps similarly often frequency. So with that, please do expect us to come out and release information that's substantial if and when that comes to pass. But I'll pass the microphone over to my colleague, Bruce Pierce, who is the Director of Community Health for the Florida Department of Health. They've been great with working with us, both Bruce and Maria, the administrator for the FDOH. I have no complaints whatsoever, and all I can say is thank you to them for the excellent job that they've done and they continue to do for the county.
Hey, thank you all. The good thing about going last is pretty much everything's been said. What I would like to say is, as was mentioned earlier, Maria is completely engaged in this and working tirelessly, and you need to know that along with all of our staff. The first thing I'd like to say is that now is the time for personal responsibility. Now's the time to engage in doing the things that everybody knows they should be doing. Social distancing, washing your hands, getting your vaccines, taking care of your health. And that's the number one thing that I can say from the podium here, is that we all need to manage our health. The healthcare system has been challenged by this, and there's no question about that. Testing has been a challenge. That's the elephant in the room. And resources are being allocated, but what folks need to know is the healthcare is poised and ready to take care of you. But you also need to take care of yourself. If you're sick, stay home. If you get sicker, call your doctor. If you're over 65, stay engaged with your doctor by the phone. If you have a life-threatening emergency, 911, as the chief pointed out. And if we can do those simple things, it'll help us in getting through this with the resources that we have.
I should also mention that we're utilizing 211 for people that believe that they might have symptoms and just need to figure out if there's steps they need to be taken to make sure they're making the right moves to get assistance, and also for information on coronavirus and COVID-19. So with that, I would like to open it up for questions. If there's someone specific you want to ask your question to, feel free to do so. Otherwise, we'll try to field the questions, depending on what area of expertise we have. So anybody want to go first?
I have a question
Go ahead, Joss.
for the Florida Department of Health. Has there been discussion about setting up mass testing sites, drive-through testing?
Bruce. Okay.
There has been discussion, and you see that throughout the state. That's based on resource allocation, and as I mentioned before, resources are a challenge right now.
Can you be a little little bit more specific? I mean, let me discuss.
PPE is a challenge, and certainly if you use that up in these mass testing sites, you won't have it in the hospitals where you may need it. You have sampling kits that you need for the labs to run those tests. You also have medium that you have to take the swabs from somebody. It also puts people at risk in doing that sampling, and I know the federal government's working on some of those sorts of things to make that a little bit safer perhaps and a little bit more widespread. What people need to understand is most people do not need a test. Most people do not need a test.
May I?
Yeah, just real quickly though.
Sure.
So we put this microphone over here if anybody wants to use it to ask questions, but I think what I'm going to do to keep you all from all having to get up and move up here is if when you ask a question, if whoever's answering that question will just slightly repeat it so we can at least give the audience an idea of what we're answering. So
Giles, that's one of the questions that the policy group was addressing as recently as 30 or 40 minutes ago. I can tell you that the FDOH Administrator, Maria Stahl, was discussing the benefits of potentially using their clinics as testing sites throughout the county. Depending on the number of tests that they receive and when they receive them, I do believe that based upon what was relayed by her, that's going to dictate in large parts how many testing sites there are and whether it's more centrally located or spread throughout. I don't know that FDOH has cleared us to release the specific number of tests that were received this week. I would encourage you to reach out to them to get that number. I've been very confident that they've been doing their job very well in terms of reporting the epidemiological data, but they do have a process that involves going through Tallahassee for the release of information to the media. So, certainly they have more info, but I would not be surprised to see it be at the FDOH clinics.
My question is about enforcement. The governor's issued several executive orders up until this point, including suspending elective surgeries and more recently this restriction on travelers coming from states that have been locked down. How are those orders enforced? For instance, the quarantine of individuals coming in from states like New York.
Hi, I'm Kimberly Prosser. I'm the Emergency Management Director. So the governor did put out an executive order that indicated that any travelers who are coming from the tri-state area, which is New York, New Jersey, or Connecticut, are instructed to self-isolate or quarantine for 14 days once they arrive in Florida. So the National Guard is meeting those travelers at the 5 major airports in Florida to provide them with that information and to provide them with documents that let them know that. I know that is going to be continued to the other airports, but currently as of right now, it's at the 5 major airports, but that's going to continue to the other ones as well.
So that would, sorry if I follow up. So it's not yet at, say, Melbourne Airport, but it is at Orlando.
I know that there's a conference call this evening to discuss that further.
Okay, and who would be responsible for checking on whether or not those instructions were followed? Because the governor's comment seemed to indicate it would be a criminal offense.
Right, that would be law enforcement.
Is the county experiencing any sort of shortage of N95 masks for first responders? I don't know who that would be able to answer that. Chief, perhaps. Chief.
So the shortage of masks and PPE is a worldwide shortage. It's not just limited to Brevard County. Yes, we have been short on some masks. We just got a supply in. We've had some generous donations from local stores like Home Depot, and we filled our stocks. We're also using very similar masks. We're using ASTM level 3 masks, which are very similar to the N95 masks. And we're also putting the lower level masks on our patients as well, so we have double protection.
Not sure who this is for, but for people wondering when the next steps on beaches would be taken, is there a specific coronavirus case threshold where you decide to take further action?
In all likelihood, it's not going to be based upon, let me restate the question. So the question is essentially what the trigger is for us taking further action to restrict access to the beaches. So it's not one where we're looking necessarily at a threshold of confirmed cases, but rather the density of those beaches. And the thing that makes it a fluid and dynamic situation more so than usual is we have 3 counties, including Brevard, statewide that have their beaches open, of which I'm aware. If we have the other 2 counties, I believe it's St. John's and then also Volusia, if they close their beaches, it's going to drive the folks that are absolutely set on going to beaches to the one county that has beaches that are at least inconveniently accessible to visitors at this time. If and when that takes place, that may well drive it. But until I have more input from the city managers and the elected officials beachside, the game plan is to evaluate it at least as often as daily and take the measures only when we need to.
Commissioner Lover, to follow up that question.
Yes, sir.
Could you discuss a little bit more about the discussion at the policy group meeting about that issue, and the officials in Cocoa Beach seemed that they were interested in implementing this now, and I guess other people were not.
Sure, I can tell you that we have a variety of municipalities throughout Brevard County. A number of them are beachside, a number of them are not beachside. They obviously have competing interests in terms of what's most important to them. There are some beachside municipalities that view this as more critical than others. Cocoa Beach in particular has been on the forefront of ensuring that we take action in as timely a fashion as possible with respect to closure of beaches. I can tell you that other municipalities have not been as fond of that. My preference that I've indicated to Jim McKnight, who's the city manager there, and Scott Morgan, who's the city manager for West Melbourne, is that they go back and they speak with their colleagues at the municipal level and then come back, since they both represent the League of Cities, one is primary and one is alternate, on the policy group, and let me know what essentially the collective will of the municipalities is. If it's the collective will of the municipalities, or at least the majority of them, that we close those beaches, that's what we're going to do.
Go ahead.
Yeah, just a quick follow-up on enforcement. Is law enforcement also responsible for enforcing restaurant and bar closures and those sorts of things?
Yes, restaurant and bar closures, as described by the governor's executive order, that is under the regulation of the Department of Business and Professional Regulation, and then law enforcement has the ability to enforce that.
So we'll take one more question if anybody's got one, otherwise we'll wrap it up.
Thank you.
Go ahead,
Giles,
Giles.
Space Coast Daily. Regarding closing of the beaches, getting information out to people maybe coming from far away, are there any plans for signage down at the stub-end streets to let people know the current policy? And education seems to be the key.
Giles, with respect to notice with closure of the beaches, should that come to pass, one of the things that we will absolutely implement is reaching out to FDOT, the Florida Department of Transportation, to request that all of the changeable signage, the LED and the illuminated signage along 95 be changed to reflect that the beaches are closed. We'll do that. Certainly we'll have press releases come through Don Walker. And if there are any suggestions from anyone here or otherwise that would help us better inform the community and visitors, we'll certainly take it under advisement. And if it's something that we can implement, we'll certainly implement it. Thank you.
All right, thank you very much.